Hi, my name is Chauncey Carroll, and my program evaluation was for a program called Royal Family Kids, which operates under the For the Children organization. This program evaluation is titled Understanding Foster and Adoptive Family Barriers, Facilitators, and Values for Participation in a Mentoring Program. I take a moment to acknowledge several people that made this project possible. A huge thank you to Melissa Tempest, the RFK director and my preceptor, and to Dr. Scott Harpen, my advisor for this capstone. I'd also like to acknowledge the amazing parents and caseworkers that were open and honest in sharing their feedback for this program evaluation. And finally, the Royal Family Kids leaders and volunteers that made this program a haven for families. First, a little background into the population that Royal Family Kids serves. Adverse childhood experiences, or ACEs, are traumatic events that occur before the age of 18 and can include experiencing or witnessing violence, abuse, or neglect, or growing up in a household plagued by substance abuse, mental health issues, or criminal activity. Many of these ACEs, especially abuse and neglect and parental imprisonment, result in children entering the foster care system. Children exposed to ACEs possess considerably higher health risks than the general population, including injuries, STIs, teen pregnancy, sex trafficking, chronic stress, and homelessness, as well as longer-term outcomes such as cardiovascular disease, diabetes, depression, and obesity. Past research and evaluation of mentoring interventions for at-risk youth, such as Big Brothers, Big Sisters, have demonstrated that consistent mentoring can reduce risk-taking behaviors such as illicit drug use, skipping school, and acts of assault. Consistent mentoring can also improve school performance and improve relational outcomes such as emotional intelligence. However, there are unique challenges to maintaining consistent mentoring with children in foster care. Foster care drift describes the common pattern foster children experience of frequent removal and returns to various home environments, making consistent mentoring especially challenging. Royal Family Kids is a faith-based international nonprofit dedicated to children with a background of ACEs. With 257 local chapters across the globe, RFK provides annual summer camps and after-school mentoring programs for children ages 6 to 12 in foster care. All programs are run by dedicated volunteers, and families pay only $25 for the entire year, while RFK fundraises the rest. RFK recently fell under an expansion under a new organization named For the Children, making it an opportune time to evaluate programs and make changes. The Colorado Springs chapter of RFK was founded in 2013 and has struggled engaging families throughout the year. Typically, 70 to 75 children enroll in the annual summer camp, and 12 to 18 children enroll in after-school mentoring, often with additional dropouts during the year. Meanwhile, there are approximately 900 children in foster care in El Paso County at any one time. The purpose of this program evaluation was to assess barriers and facilitators, caregivers' experience for participation in RFK, and to make recommendations for RFK leaders. Caregivers was defined in this project as foster parents, adoptive parents, kinship providers, which are family-like adults or relatives, and caseworkers. There are three main research questions. What factors could lead to participation in RFK? What factors could prevent participation in RFK? And what do caregivers care about the most when considering mentoring programs like RFK? Caregivers that were recruited by email and text using RFK databases and the snowball method to identify additional informants, including those unfamiliar with RFK. Qualitative data was collected through 9 semi-structured interviews, assessing beliefs, values, and experiences. 4 were active participants in the local chapter, 2 of which were fostering and 2 that had adopted their children. I interviewed 2 people that had no prior experience with RFK, one which was fostering, the other had adopted. I also interviewed 3 caseworkers at the Department of Human Services, 1 that worked in kinship care, 1 in an adolescent unit, and 1 in family treatment. 2 of the caseworkers had prior experience with RFK, and 1 did not. All interviews were recorded on Zoom. I transcribed these interviews using Word dictation software and developed a coding scheme using enumerative and thematic inductive analysis. Finally, I completed member checking with interview participants to confirm understanding and to see if they felt their perspectives have been interpreted correctly. Qualitative analysis revealed the strongest facilitators to participation in RFK included a thorough understanding of trauma, a sense of trust between volunteers and families, individualization to support a variety of needs, a focus on community and fun, and strategic caregiver engagement to gain buy-in. One caregiver summarized it this way: the fact that they get their own mentors to do their own thing with is really meaningful to them. For a kid who is one of 9, that's a significant thing. RFK does so well putting the focus on the individual child and who they are as a person, not what they've done, where they've been, or what their rap sheet looks like. Several common barriers included intense trauma behaviors and their effects, lack of time from extensive demands, limited accessibility due to eligibility requirements, and loss of resources post-adoption, perceived stigma and lack of diversity, and communication challenges. One caregiver put it this way: we were just processing how to keep our 2 kids from drowning and how to keep ourselves from drowning. It never crossed my mind, what do we need from a mentoring perspective? Key values prioritized family preservation, commitment to a higher purpose, and diversity in mentoring. Whether it was a foster parent, adoptive parent, or caseworker, they all described the ultimate goal of stability for their child. Caregivers also loved the spiritual aspects of RFK, and that mentors were encouraged and trained to provide spiritual guidance in a non-pushy way. Finally, caregivers valued both diversity and ethnicity and in-life experience for representation and mentoring volunteers. They felt strongly this would validate the experiences of fostered and adopted children and help them move forward in more relatable, culturally sensitive ways. One caregiver hit it home with this statement: we have 2 boys adopted from Uganda and Rwanda. That has been really hard when we're in such a not diverse area. If we had solid Black mentors for our sons, I say most honestly, that kind of thing is what would make us clear our schedule for anything. Diversity is super important. That's definitely the big stuff for us. These findings can be situated within current theory on best practices for caring for children with adverse childhood experiences. The ACE study was a landmark research study focusing on the role of childhood adversity over the lifespan. The National Health Collaborative on Violence and Abuse is an organization of more than 30 public health societies that informs public policy regarding these issues. They have compiled best practices from the literature, and to address these adverse experiences, a systemic trauma-informed approach is critical and includes 7 core components. 1, maximize physical and psychological safety for children and families. 2, identify trauma-related needs of children and families. 3, enhance child well-being and resilience. 4, enhance family well-being and resilience. 5, enhance the well-being and resilience of those working in the system. 6, partner with youth and families. And 7, partner with agencies and systems that interact with children and families. In light of this discussion, Royal Family Kids within the For the Children organization is in a great position to be the go-to non-therapeutic resource in the community for fostered and adopted children and their families. One recommendation includes expanding eligibility for already adopted children. Current RFK policies state that if they are adopted after already participating in RFK, they are allowed to remain in the program until they age out, but they cannot join if they've already been adopted. I recommend opening up the program to kids that have already been adopted into their families, regardless of when this adoption occurred. Also, RFK should consider expanding access for teens. Teenagers face more pressures and demands from all directions than adolescents do, making mentoring during this development period even more critical. Another recommendation is to engage with the entire family unit. One child's trauma affects the entire family, including other children living in the home. My recommendation is for RFK to extend additional opportunities to include foster or adoptive parents, kinship providers, and other foster siblings or biological siblings living in their home. Finally, RFK should consider more frequent communication with caregivers to improve awareness and understanding. With the high turnover nature of foster care in both the professional and parental world, frequent and creative communication is necessary for success. There are some limitations to consider. Since this was a program evaluation specifically for Royal Family Kids, it is not generalizable to all mentoring programs and merits further study. Even with multiple recruiting methods in place, it's likely that selection of bias occurred, with willing respondents potentially already being more engaged and open to the idea of mentoring programs for their child. Also, respondents were speaking to their experience in El Paso County, Colorado, so it may not reflect accurate experiences of other RFK programs around the country and around the world. Unfortunately, I was not able to speak directly with any biological parents that had children in the program, so we would be missing some key perspectives. These are my references. Thank you so much. Do you have any questions?